Which anemia results from vitamin B12 deficiency? Pernicious anemia. It occurs when the body cannot absorb vitamin B12, leading to reduced red blood cell production. Which neurotransmitter is reduced in Parkinson's disease? Dopamine. One is low from dying brain cells in the substantia nigra, leads to tremors and stiffness. What is the medical term for difficulty swallowing? Dysphagia. It occurs when nerves or muscles controlling the throat and esophagus don't work properly, such as after a stroke or in neuromuscular disorders. What is the medical term for high blood sugar? Hyperglycemia. This often occurs in people with diabetes, when the body doesn't produce enough insulin or can't properly use the insulin it does produce. What does the P in CPR stand for? Pulmonary. It refers to lungs in cardiopulmonary resuscitation. What is removed during a hysterectomy? Uterus. It is removed to treat conditions like cancer, fibroids, or severe bleeding. What connects muscles to bones? Tendon. It transmits force from muscle to bone. Which test is used to diagnose hyperlipidemia? Lipid profile. It measures cholesterol and triglyceride levels in blood. High levels means too much fat in the blood. What is the term for involuntary repetition of words? Echolalia. It may occur after brain injury, in Tourette's, or in developmental disorders like autism. Which part of the hand is tested for vibration sense? Fingers. The fingertips have high-density vibration receptors, while other areas of the hand are less sensitive. The Tinel sign indicates which condition? Carpal tunnel. Tingling when tapping indicates median nerve compression. Which ketone is best detected in urine dipstick? Acetone. It is produced during fat breakdown in ketosis. Which nutrient deficiency causes goiter? Iodine. Without iodine, the thyroid enlarges to try to produce enough hormones. Which cranial nerve is affected in Bell's palsy? Facial nerve. It controls facial muscles, can become inflamed or compressed, causing weakness or paralysis. Which organ produces insulin? Pancreas. It regulates blood sugar by releasing insulin. Which heart valve is most affected in rheumatic disease? Mitral valve. It is located between the left atrium and ventricle and is the valve most often damaged in patients with rheumatic fever. Which imaging is best for soft tissues? Magnetic resonance. It shows detailed images of muscles, ligaments, and the brain, useful for diagnosing soft tissue injuries. What is the medical term for nosebleed? Epistaxis. It occurs when you lose blood from the tissue lining the inside of your nose. Although they can be annoying, nosebleeds usually aren't a cause for concern. Which lung disease causes enlarged air spaces? Emphysema. It's when the alveoli get bigger and trap air, so your lungs can't get oxygen into the blood. Which hormone confirms pregnancy in blood tests? Chorionic gonadotropin. The placenta releases it early in pregnancy, showing that a fetus is developing. Which eye structure becomes opaque in cataract? Lens. Light is blocked when the lens clouds, making vision blurry. Which mineral is regulated mainly by aldosterone? Sodium. Aldosterone keeps sodium levels balanced, which helps control blood pressure and fluids. What is the medical term for low platelets? Thrombocytopenia. With fewer platelets, the blood clots poorly and bleeding risk goes up. Which clotting factor is activated by vitamin K? Prothrombin. It enables the liver to modify prothrombin so it can interact with other clotting proteins and form a blood clot. Which wrist bone is fractured most often? Scaphoid. This small wrist bone is commonly broken when people fall with their hands stretched forward. Which artery is palpated for neck pulse? Carotid. Feeling this major vessel lets you quickly check heart rate and circulation. The Mantoux test is used to detect which disease? Tuberculosis. A small skin reaction shows if the body has been exposed to TB bacteria. What is the medical term for kidney stones? Nephrolithiasis. Crystals form in the urinary tract and can cause sharp pain when passing. Which enzyme rises most in pancreatitis? Amylase. When the pancreas is inflamed, this enzyme leaks into the blood. Which hepatitis virus spreads through contaminated food or water? Hepatitis A. This type of hepatitis is preventable with vaccines and careful hygiene, as it mainly infects the digestive tract. Which autoimmune disease often causes a red rash across the cheeks and bridge of the nose? Lupus. The immune system attacks the body, producing a distinctive facial rash over the nose and cheeks. Which nerve is compressed in carpal tunnel? Median nerve. Tightness in the wrist makes the hand tingle, feel numb, or weak. What is the surgical removal of gallbladder called? Cholecystectomy. It's performed when gallstones or infection cause pain or inflammation in the gallbladder. Which part of the ear contains the cochlea? Inner ear. The cochlea changes sound into signals the brain can understand. The Schilling test is used to detect which anemia? Pernicious anemia. It checks if vitamin B12 can be absorbed by the body. What is the main cause of heart attack? Thrombosis. A blood clot blocks an artery, stopping blood from reaching the heart. What is the medical term for gallstones? Cholelithiasis. Hard particles can form in the gallbladder and sometimes cause pain. Which hormone is overproduced in acromegaly? Growth hormone. It is produced mainly by a tumor in the pituitary gland. This excess of growth hormone can cause some body tissues, bones, and organs to increase in size. Which lung disease is linked with barrel chest? Emphysema. Air trapped in the lungs pushes the chest outward. Which valve separates left atrium and ventricle? Mitral valve. It keeps blood from flowing back into the atrium when the heart pumps. Deficiency of which nutrient leads to night blindness? Retinol. Without vitamin A, it's hard to see in dim light. Which cranial nerve controls smell? Olfactory nerve. It sends signals from the nose to the brain so you can smell. What is the medical term for fainting? Syncope. Brief loss of consciousness happens when blood flow to the brain drops. Which organ is inflamed in gastritis? Stomach. The lining swells, causing pain, nausea, or indigestion. Which part of the brain controls balance? Cerebellum. It keeps your movements coordinated and helps you stay upright. What is the medical term for kidney infection? Pyelonephritis. The kidney and its pelvis become infected, often causing pain and fever. Which gland releases parathyroid hormone? Parathyroid. It keeps calcium levels in the blood within a healthy range. Which connective tissue stores fat? Adipose. It acts as a cushion and energy storage in the body. Which joint is inflamed in gonarthritis? Knee. It can be chronic or acute. Gon means knee in Greek, and inflammation causes pain and swelling.